point.
All right, once again, with me in the studio, I've got Larry Dent. And Larry, that shut me down there, but anyway, I'll go ahead and turn the mic over to you. Thanks for being here this morning.
Okay, John, thank you, and I really appreciate WVRC allowing me this opportunity to come to you on the radio. I really enjoy the medium of radio because it gives you a chance over a little longer period of time to explain things that you just don't have time otherwise. And I really appreciate working with the staff at Family Healthcare. Wonderful people. And you know something, I'm going to read you just a little something here to get into this. And I want to talk about getting fired last week. It's not really about me getting fired. It's really about the future of family healthcare and how important it is to this community and this cancerous relationship between the board of directors of family healthcare and the mayor, Terry Williams, and the city of Spencer. I've been doing this work for 40 years. I've never seen the level of hostility or political influence that I have right here in Spencer. But anyway, let me read you something. The people of Roane County have always accepted not having the best roads, the best in water or rail transportation, but something we have never accepted is being second to anybody in the dedication of our people. And you know who said that? Terry Williams. And you know something, Terry? One of the very few times we probably agree on something. I came to Roane County in 2002 to help the Committee on Aging, and I've been retired. I retired the first time in 1990 in Morgantown. Was retired for 10 years. Went back to work, did a one-year grant program, came to Roane County at the request of a friend of mine to help the Committee on Aging. I was ready to leave and was asked to take over Roane County Family Healthcare as CEO when it was dead broke, couldn't make the next payroll. Employees were very, very demoralized because they knew that it didn't have to be that way. So anyway, and I want to thank the Committee on Aging board because they allowed me one solid year to be on the payroll of the Committee on Aging while I actually worked at Family Healthcare. Chuck Ricks did a wonderful job, and I just can't thank them enough because they really picked up the community spirit and allowed me to do that. And we had a wonderful relationship there. I could not express my gratitude more for Charles Mace and the board. The board at the Committee on Aging is wonderful. But anyway, I went over to Family Healthcare. It was a mess. I looked at this old run-out building and started doing the background work on it, looking at deeds, legal descriptions, everything. And I could not believe that any reasonable thinking person would ever buy a run-out old building that was full of asbestos, heavily vandalized, been vacant for about 4 years, on a postage stamp piece of property. All this frontage, 270 feet or so of frontage with no parking. That building was built as part of a residential community, part of the old state hospital building. It was never designed to be built as a high-volume medical practice. Even their old feasibility study that they did back to help get financing said it was going to take 34,000 encounters a year, and we've just reached that in the last year or so. It was a physical and financial impossibility for success, and I kept wondering why in the world people would do that. The board at Westbrook, I understand, took a look at it and ran the other way and built a building of their own that you can see out on Highway 36. It's a nice building. So why did not the board of Roane County Family Healthcare do the same thing, especially when the Hex building at the same time was totally vacant and available and actually sold for $120,000. So that's how it started. The darkest day in the corporate life of Roane County Family Healthcare was October the 16th, 1996, when Tom Whittier signed the deed accepting that deed and that building with all the restrictions on it that the city had put on it. It's the only place I've ever seen a city actually pass an ordinance requiring restrictions in favor of Roane General Hospital to keep family health care from competing with Roane General Hospital. And then if you drill down a little bit, what you see all kinds of restrictions in the original deed that's designed to give the building back to the city in the event, in the likelihood, I should say, of family health care actually failing. From 1996 until 1999, they borrowed $1.5 million from the USDA. And the other story, the sidebar story, is why the USDA would ever fund that project. I have been dealing with the USDA all the way to Washington, D.C., asking them to commute that to time served or actually payments made, because it's silly. I mean, it's ridiculous. The USDA has high standards. Somewhere somebody looked the other way in order to fund this project, because it's worthless. So anyway, we've been suffering with this old run-out building. You talk about, in the last election, they talked about putting lipstick on a pig. If you want to see a great big pig with a lot of lipstick, all you got to do is go to Family Health Care. Dave Phillips is totally and completely responsible for keeping that thing going. In the last 60 days or so, I mean, I was able to secure $500,000 in the ARRA stimulus money. They spent $50,000 putting a new roof on it. They spent $30,000 just fixing the air conditioner tower. That building will probably not last as long as the mortgage, which is another 20 years. It's a horrible building. It's the worst building I've ever seen for practicing medicine in. And if you drive up there, and many of you listening today are patients, at this point in time, Family Health Care has got 7,500 patients. Half of them live here in zip code 25276. And Family Health Care did 36,000 patient visits last year. It's a very, very big player, specializing. It's a federally qualified health center, one of 29 in the state. And it specializes in helping people, providing barrier-free medical care, barrier-free professional medical care to all persons without regard to financial qualification. So it's a great asset for this community. And why the level of hostility is there between Mayor Williams and the city government toward family health care is a mystery to me. We work well with Roane General Hospital. I'm pretty aggravated at Doug Bentz right now because he just recruited Grant Parkins away from family health care, and Grant will be leaving family health care July the 31st to go to Roane General Hospital. So instead of spending $30,000 to recruit a physician, he just comes down and plunders ours. So anyway, I've got a little problem with that, but nevertheless, Grant has done well for us, local Roane County boy, and obviously he'll take a lot of his patients with him. So anyway, what's the crux of this? The crux of this radio show is not my being fired. Being fired is part of my job description. As a turnaround CEO for 40 years, any CEO who is afraid of being fired just shouldn't have the job, because there are things you have to do. There's people you have to push. My job is making people do what they don't want to do. Albert Einstein said, if you do the same thing every day and expect different results, it's a sign of insanity. And what you cannot do, I mean, if you're working in a failed system like family health care was when I went there, was totally failed, what you know is failure is always at the top. Failure, I do the same thing. One of the reasons I do this is because I'm pretty lazy. I don't have to learn anything new. In 40 years, I don't have to learn anything new. I've done this in Philadelphia, Los Angeles, San Antonio, Seattle, Cleveland, everywhere else, big systems, and it's always the same. The failure of the system is always at the top. And so I'd save that to last. Now, firing me is of no consequence. Trying to punish me is silly, because that's impossible. It's a fool's errand. My contract was actually up the end of January. I had already told the people at Family Health Care that I was not going to renew my contract. I have an apartment 4 blocks from the ocean in South Beach, Florida. My wife was overjoyed to find out that I'd been fired, because she's been waiting on me for several years to go to Bulgaria and go to Mexico and to do some things. My wife has a PhD in industrial design. Most of you know her here. When she's up here, she absolutely despises living in Spencer in West Virginia. As a matter of fact, she speaks Spanish most of the time. What she told me when I got fired, she says, leave the soft caca in Spencer and don't track it home. And I said, okay. It's actually kind of funny. It's just kind of funny in a way. It wasn't so serious. But the problem at Family Health Care, again, it's not about me being fired. I could care less about being fired. I was on my way out anyway, and already